Hello there, and happy Friday lunchtime. I join you here every Friday to talk about what we're learning and doing here at Reactive. My name is Julie Hirschberg. If we haven't met, I'm the owner and founder of Reactive Therapy and Wellness here in the LA area. And I'm a neuro PT, I'm a professor at USC, and overall passionate person about neuroscience. And I read a ton, kind of addicted to it, and a lot of research articles and things like that. And I really love sharing them with you every week. And particularly, I got inspired this week. This week, we hosted a workshop for people with Parkinson's. It was sponsored by the Parkinson's Foundation. Thank you, Parkinson's Foundation. And it was really about how to set up and stick with a habit and stay motivated um, to to have a healthy habit, whether that's exercise or eating or just activity level, any kind of habit. And I then, of course, had to do a lot of reading. Now, I have some of my favorite articles in Parkinson's and exercise that I shared in this workshop. And I have to share it with you, but I really just took it a whole nother level deeper. And that was to look at some of the why. Why does this stuff work? Why does it help people? Uh, why does exercise help people to stay motivated? Why does it help change their neurologic symptoms? And how? How should we exercise or move or set up therapy to do this? And honestly, it has changed my whole view of how we should do therapy for people. And it's changing because my view is changing, because the literature is changing. Reactive as a practice is changing. So today we're going to talk about BDNF, or brain-derived neurotrophic factor, and we're going to talk about intensity of exercise. So let's just hit on first, if you haven't heard of BDNF. I actually, by the way, if you're not already on our newsletter, you should join. I send out all the links to the videos that we talk about and the research and resources, all of that, because I'm going to share one of my first resources right off the bat. And that is my favorite podcast. It's the Huberman Lab podcast. Andrew Huberman is a professor at Stanford. He talks neuroscience quite a bit, and he brings on some great guests. And this week, he brought on a guest who I follow quite a bit. I follow her research, Dr. Wendy Suzuki. And the episode's called Boost Attention and Memory with Science-Based Tools, but it wasn't just about that. There was a lot on BDNF. And I love BDNF. We talk about BDNF in a lot of what we do. Mike Studer, who teaches a lot of our courses, talks about it a lot. But the way she described BDNF in this podcast, I really loved. She described it as a bubble bath for the brain. And all I could just imagine was just kind of like bubbly, yummy smelling things all over my brain, helping to improve connections and synapses. And that is basically what BDNF is. So I love a good review article. When I'm going to look at some of the basic science stuff, I love a good review article. There was one recent, and I'll put it in the newsletter today, brain-derived neurotrophic factor, a key molecule for memory in the healthy and pathological brain. So, BDNF is a neurotrophic factor, meaning it really helps neurons to grow and stay thriving in the brain. And it's very regulated. There can be a lot of variability, and it changes with input to our body. This review article actually has a really lovely graph in it, and I'll actually put this graphic in our newsletter as well, because I love it so much. It talks about the things that tend to decrease BDNF and the things that increase it. So here are the things that decrease it, and it has evidence for animal and human studies. Aging, unfortunately, Alzheimer's disease, chronic stress. We also know there's other literature that shows that it decreases with an acute brain injury and is actually correlated with how severe and prolonged the injury and recovery is. This is really important, right? Because when we think about our concussion treatment, then we want to be thinking about what can we do to promote BDNF levels. So what are those things that increase BDNF? Exercise across the board increases it. Having an enriched environment. Also things like antidepressants increase BDNF. So one of the things that they talked about in this review article that I really liked is they actually looked at how exercise might help with the lowered level of BDNF that occurs in PTSD. And there's interestingly a lot of rat studies here. And what they found is that you could give rats antidepressants, it helps, but nothing is as good as exercise and an antidepressant, or even exercise alone is even better than an antidepressant. So there is something about moving and exercising that really enhances that BDNF expression, particularly in the hippocampus, the memory center of our brain, which many of us, I like fully will say, like, my memory is declining as I age for sure. And it very much is impacted by neurologic or chronic disease. Our memory is. So again, a lot of evidence for us to really kind of get excited about things that can improve BDNF expression in our brain. Enriched environments, exercise, two big things that we can look at and control. Now, how did I get down this pathway of BDNF? Except for that, it's just like the most wonderful thing in the brain. I got here in a couple of steps as I was preparing for our workshop this week. One was there's this really great study that I talk about all of the time when I talk about Parkinson's. It's from 2015. It's from a group in Italy. Frazita is the main author, and it's called Intensive Rehabilitation Treatment in Early Parkinson's Disease, a randomized pilot study with a 2-year follow-up. What did they do here? Basically, they had people participate in a multidisciplinary rehab program for 4 weeks at a time, and then they looked at their outcomes long term. Now, clearly, they did really well right after the rehab, right? But what was even bigger was all the way down for that 2-year time, they kept those improvements that they made. And those were on things like the timed up and go, the UPDRS, I think the 6-minute walk was in there. But even more importantly, and this is where the brain change comes in, is they found that those people, they compared them to controls, those people in this intensive multidisciplinary rehab had to take less medication, less Parkinsonian medication. Something was changing in their brain due to this rehab. So I was curious about this, and so clearly were they. This group also looked at BDNF serum levels, and what they looked at is, do those change with this multidisciplinary intensive treatment? And yes, they change with the therapy, and they stay that way, even when they are no longer in that therapy. Now, it doesn't mean they're not doing things outside of that therapy, right? So if they're having an intensive therapy bout, usually they're working to drive some habits and practices that the person maintains really throughout their life, right? So this is what really got me excited. I've known about this Frazita study for a while. It's been out since 2015. It always got me really excited about doing a more intensive and multidisciplinary bout of therapy for people. Um, and then when I look and found this BDNF study that also found these changes with this intensive therapy, I said, yes, that makes a lot of sense. When we do our intensive programs, which we do across the board for diagnoses, but primarily our largest group is for people with functional movement disorders, post-concussion, with dizziness, with dystonia, with other neurologic disorders, and with Parkinson's. When we work with people in a multidisciplinary way on our integrated team, almost daily therapy, 2 weeks, 4 weeks, 6 weeks, sometimes 10 weeks at a time, people do really well. We have really great outcomes. They go from not walking to walking. We just had an amazing client who got a NG tube out because she could be eating and swallowing again. So really great outcomes with that. We've talked and interviewed people all the time for that. And part of that is probably BDNF. They're getting the substance that literally drives neuroplasticity. Now, we don't measure it at our clinic. We maybe should. That's probably a research trial. But it makes a lot of sense. Repeatedly, an enriched environment and exercise increase BDNF. So that is one of the big reasons we do an intensive program, because we know this is what it takes for neuroplasticity to occur. Now, does this mean that doing something once a week or twice a week, even 3 times a week, is not helpful? No, absolutely. We have evidence for those models also being helpful. I will say though, in the disorders that we are seeing, having that multidisciplinary team work with a person holistically in an intense bout, we are seeing outcomes of people getting better faster and sustaining it. And so this is the model that we are moving to at Reactive. We, as of now, we have about 40% of our practice in more of that model, and that's going to continue to grow and grow. And so we're pretty excited about that. I would love to hear from you. If you're a healthcare provider, what model are you using? What outcomes are you seeing? What are some of the challenges in a more intensive model? And if you're a person with a neurologic disorder, I'm curious, have you had that kind of more intensive and integrated and multidisciplinary care? Because that is definitely what we're doing. That's where we're seeing outcomes. And it's a shift. It's a shift from a more traditional model. So it's not easy. It's logistically kind of challenging for a practice to make a shift, but that's a shift that we're making because of the outcome and benefit for people that we're seeing. So thanks for joining me with a little BDNF talk today. I love learning, and I love sharing it with you. And if you're not already on our newsletter, you can sign up. If you're a healthcare provider, sign up at reactiveeducation.com. We send out the newsletter on Fridays. And if you are a person with a neurologic disorder or chronic condition, sign up at reactivept.com, and we send that out on Monday for a newsletter specific to you. And if you're interested in this kind of program, you can apply online. It's reactivept.com. You can go to our services and integrated programs. You can apply. We get back to you and set up a consult and see if it's a good fit. We're actually enrolling people right now for programs in August and September and October. We have a couple openings left. I know most people, once they hear about this, they want to start it right away. One of the logistical pieces is to start a major program like that with all those disciplines. It can't happen overnight. It takes a little while to put that together. So we're scheduling for August now, and we have a couple spots, but also September and October. So you again, that's at reactivept.com. Thanks so much for joining me on this journey of life and learning, and I will catch you next week.